started recording again for us, so we'll start from the beginning, if I may. So warm welcome to everybody to this joint meeting of Adult and Child and Family Services Scrutiny Performance Panel. Obviously, it's important one in terms of the budget that we need to look at and see how that goes later on. I know we can have a presentation, Jane, and we'll take it from there. Item 1 on the agenda then. Oh, sorry, I should have said welcome to everybody as well, which I said the first time, but I forgot the second time, but that's me, I suppose. So my apologies for that. And I welcome everybody to the meeting. Item 1 is apologies. And we have a couple of apologies, I think.
We've received apologies from Cheryl Philpott and Mike Day, Chair.
There it is.
Kevin,
I'm Kevin, isn't
Kevin
it?
has put something on the chat line.
Sorry.
Kevin has put something on the chat line.
Oh,
Kevin Griffiths.
okay. And Kevin as well, thank you. We haven't got it here at the moment, so that's fine. Item 2 is disclosures of personal or prejudiced interest. If anybody's got any way want to make at this stage, this is your opportunity to do it.
Yes,
Chris?
Paxton, my daughter
Yeah,
works
Chris.
for social services, so I declare a personal interest only, not president.
Okay, thank you, Chris.
Sorry, Paxton. Can I give Alison Pugh's apologies as well, because she's had a bit of a setback with her broken leg, unfortunately.
Sorry to hear that.
Okay, give our best wishes then, if you would. Item 3 is prohibition of whip votes and declaration of party whips. Anybody got anything they want to say to that? No. Item 4 is public question times, and we haven't got any questions, so I go straight on to item 5. As I said, as I was saying before, it's draft budget proposals, obviously important, and at the end of the day, we will have, as a committee, have to make our representations on that and report them back to Chris at the Service Improvement and Finance committee meeting tomorrow morning. So, without any further ado, let's move into this now, and I think, Jane, you're going to do the presentation. You want to start off first of all? Okay.
Yeah, thank you very much to the panel. Thank you for having us today. Obviously, really important to scrutinise the budget. Wanted to put on record my thanks to all the officers, because this has been an incredibly difficult process. Obviously, we've been in austerity since 2010, the impact of the pandemic, the demographic changes to our population, workforce pressures, the current cost of energy, cost of living, cost of energy crisis. I know it's a cliche, but it really has been a sort of perfect storm of difficulties. But saying that, we've tried to keep our priorities, our guiding principles behind us at all times. If you look on the cabinet papers, those are outlined on page sort of 45, 46, and we've really been guided by doing what matters, working co-productively with children, families, and people that we work with, working towards better integration with our health service colleagues, transforming our services for the better, and making sure that that's at the back of our minds with everything we do, continuing our approaches in terms of prevention and early help, and making sure most of all that safeguarding is at the very top of our list. Hayley.
Yeah, so I'm Hayley Gwillam, Cabinet Member for Community Support, and Early Intervention and Prevention sits within my remit. And not to duplicate what Louisa said, but we are committed to our wellbeing agenda and promoting best outcomes for the people that we're working with and the people that we serve, to allow our residents to live happy and healthy lives.
Thank you, Chair. Thank you. I'm going to attempt to share the screen. Hopefully, this is the worst part of it, isn't it, actually? Okay. Is that okay? And can everybody see it? Yeah?
Yeah.
Okay, fantastic. There we go. Okay, so I'm going to take us through, like we did last year, in terms of just a summary of the budget position and the savings proposals that's in the Cabinet papers. the budget for 23-2024 has been relatively protected in terms of the uplift from Welsh Government funding. So it does see a cash increase of around 7 to 8%. We've done a conversation and it's a cash increase of about 11.5 million. And that additional targeted cash has been directed straight to social services, and that is to cover all of the pressures that we've just talked about in terms of inflation, the cost of placements, the increasing pressures due to the demand for adult social care, the pay awards, demographic pressures. So that comes in as about our core money, which is what is the budget is proposals are based on. There's also just to note that we talked about last year in terms of the grant pressures that so we have around a cash limit of 157 million, and there's also added to that as around 70 million worth of grants that come in around operating across the directorate. Those they do have significant pressures because they are flat. There's been no uplift to those grants, so that it does cause us a little bit of an anxiety as we go forward, but that's the position, and is much better than we thought it would actually be when we started the process back late in 2022. If I move on to our savings proposals, we're taking the pressures that we've, across the directorate. It means that we still have that as a priority, that we maintain our good fiscal discipline, as our director always tells us, to make sure that we're doing the best we possibly can, and that continuing business-like approach to making sure that we're effective and as efficient as possible, and where we invest where we have the greatest benefit for our population. So the direct savings proposals for 23-24, as outlined in the medium-term financial plan, are around 6.1 million. But there is no impact on loss of staff or services in terms of what that means for us, which is really important. And we believe, like we did last year, that our savings are achievable as we continue with our business-like approach and maximise efficiencies by working smarter together. I guess it's probably noteworthy just to say for last year, we did the same last year, and that we have achieved all our savings from last year going forward. So we're carrying no added savings pressures into the next financial year. So if I go into the details of the existing budget savings. So these are noted, obviously, in the papers. So just a bit of an explanation around them. So these are existing budget savings. There's one around the supported living framework, and there's one around voids in the system, around changing the business model. These savings have been existing in the MTFP for a number of years, and they're on track with no significant implications. They're around efficiencies and working smarter. So they're the existing ones that remain in, and this is the final year that you'll see them. They won't be here next year. I go on in terms of the ones that are existing. So these two are very similar in terms of working through the complex needs of high cost placements. We're both in child and family services and in adult services, and working with health and education. So we achieve that reduction in high cost packages and effective working between the agencies. And I guess it's important to note these have been in for a while. These savings proposals are all something that we have year in and year out, and continue to work towards making sure that they are planned and they're based on the assumptions of our funding agreements, and they're formalised in terms of increased partner contribution. So we always have those going through to make sure that we're income recharging as best we possibly can. The other ones, and the existing ones, is of course a whole directive saving, and that was about this is an existing one that's been in for a number of years now. And that's around replacing non-strategy teams with grant funding when the grant funding becomes available, and saving core money through different national, local, regional opportunities. This is probably the last year we'll see this one in, as we think we can manage it this year, but it is becoming increasingly more difficult to do that. And the other one is around the recommissioning of supported accommodation for children, the 16 plus children. That's part of a framework agreement that's going to go out to the market, and we think that will achieve some efficiencies. But again, these two are existing ones. They've been planned over a number of years. There's no significant implications, and this is probably again the last year that we'll see these. So they're all of our existing savings that'll carry forward into 23-24. And then we get onto the new savings proposals that were needed in terms of closing the gap between the cash limit available, and then the amount of money we need to operate. So these three are cross-directorate savings and apply both to child and family services and adult services, and in terms of those the areas in between across cross-directorate services. So the first one is around introducing a vacancy provision. And that is a saving of an estimated saving of £1 million, but it doesn't have any implications on staff and numbers or reduction in posts. But what it does mean is that there is a line in all of the staffing budgets that takes some money out, because when somebody leaves a post, there's a good 3 months before we can recruit, if we can, all being well, that we can recruit into there. So we believe that £1 million savings on a 90 million staffing budget across both grants and core money is achievable without any significant impact, but it will need to be monitored carefully as we go through the year. Then the other two savings have been their one-off savings advised by the 151 officer around the savings on pension costs and the reversal of the NI. So they're probably common in lots of the directorate savings that you'll see coming in, but so they are very much one-off savings in terms of 23-24. They won't repeat or get bigger savings as we go forward, because I think once we've done them once, that would be it. So if I go on to the specific ones, so child and family services, there's a saving proposal for 500,000, and that's looking at the placement costs and negotiations with providers. So it's again about our commissioning approach and our efficiency about that negotiation to make sure we're getting really good value for money and the best placements for children and young people. We do believe that's achievable this year. However, we are worried about what that looks like in future years around when we get into the terms of Welsh Government's eliminating profit from this market agenda. And of course, the market is very fragile as it is at the minute. So again, okay for this year, but we'll need a close watch as things go on and things progress there. Adult services then are moving to there's one around reviewing extra care services and recommissioning a different type of model. So that's an efficiency saving of around 100,000, but it really needs to be worked up in detail so that we understand what does that service, the design and delivery of that service need to look like for those individuals. The current extra care model is quite outdated. It's been in place for a number of years. We haven't really gone and had a look at it, but actually how can we deliver that in a better way? If I go on to the next adult services savings, then this is £1 million, and this is looking about increasing client contribution and review of all of the fees and charges, and that's in line with the corporate review of fees and charges across the council, with an estimated 10% rise in line with spending restrictions and inflation. So that we think that extra income will have a receipt of £1 million on our budget. But obviously we needed to make sure that it was a safe and the right thing to do, and then we weren't impacting significantly client groups that are struggling to pay anyway. So we had a full consultation and a full integrated impact assessment on this one, and the findings of that is that actually 75% of people who pay a contribution wouldn't be impacted because of they already pay the maximum charge that's laid out by Welsh Government. So the 25% who would, in terms of what came back from the budget, the consultation was actually people were happy to pay a little bit more. That was okay rather than lose their service. But it's that looking at that really close monitoring of the 25% and the impact of this and how it would go through if it and play out well for people. And that's the last one in terms of they come to the 6.1 million, and so just sort of in terms of our summary is around all of our work around our savings. They literally will shape our transformation work, because actually it's how do we transform to make the savings, but in make sure that we are providing the best possible services for our communities. As Councillor Gibbard said, in terms of embedding co-production and working together as much as we can to make sure that we design and deliver services that meet the increasing demand and that people need and want to make sure that they have those best outcomes and what matters to them. Okay. That's the last one, Chair. Okay.
Thank you, Jane.
Thank you.
Obviously, from members' point of view, you've seen the papers, you've heard what Jane has had to say. Has anybody got any questions at this point in time? Oh, sorry. Tony, first of all, then, if I may, and I'll come back to you afterwards, Chris.
Okay, no problem.
Oh, sorry, I hadn't seen Councillor Holly.
Oh, Tony.
First of all, a comment and a couple of questions, if I may. I mean, the comment is to note that the way that social services seems to have operated with a higher level of efficiency is welcome, and I just note the overspends in corporate services and place, but I'm not on those committees, so it's just interesting to see the contrast. A couple of minor comments, and then one slightly bigger one at the end. I think I saw in the papers that there's a reference to track, trace and protect being in the budget. I find that strange because I thought that was a public health matter and therefore should fall to the NHS to fund. But that's just me being curious. Again, a second minor question. Years ago, there used to be a report on the trust funds that the local authority held in relation to various activities. And I wondered if any of those have been looked at to augment the spending in social services where the terms of reference of the trust fund so apply. So that's the second minor question. The third observation is you said that savings would arise from vacancies releasing expenditure in terms of salaries and wages, but presumably those people were providing a service, so that service has to continue. So if you can explain to me the magic behind that. But the final question is in terms of an impact assessment. I may have missed it in the papers because there's an awful lot of them and a lot of papers to read, but I'd be interested to get both a sort of political view and an officer's view as to the values or the policies or the ambitions that have underpinned the way in which you've gone about reducing the expenditure while maintaining the service. And just to finish off, I'm just slightly uneasy about the fact that we're putting up the fees for people who are probably already somewhat pressed in terms of their ability to pay, again, especially given the tidal storm into which this country, not Wales, but the United Kingdom is currently sailing. Thank you, Chair. I'm sorry I've gone on so long.
Who wants to take that one? Okay, Chair.
Okay. I'll do the easy ones. So the track, trace and protect. I think that must be a mistake in the papers. I'll just go and because I don't think that's us as our service. So I'll just go back and check that one. In terms of the trust funds, it's a really interesting point. So yeah, there are multiple trust funds that the council sort of administer on behalf of the trust. We have got some that we have released. Some that support services of domestic abuse, some that support children in need, constantly reviewing them all the time to see if they can bring them down and they support the communities in a different way. But there's probably actually something that we need to bring to the table to make sure that we are reviewing that and going through there. Absolutely. The vacancy provision, if in terms of how that works, is that the reality is that if you put a budget in for a member of staff for a full year and then they leave and there is a gap, isn't there? Obviously, and that's where the saving comes from. But you're right to note that there is the gap in provision. So it's one of the things that we looked at really carefully to make sure that we don't take our staffing levels down to a minimum, that we're operating above our sort of minimum safe staffing levels to adjust for those very reasons. I think, and that is probably my bits over. I can answer if that's all right, Dick. Thanks.
Yeah, I'll give an officer view on the principles that we've applied, albeit I hope these are the principles that we agreed, both officer and political. And the cabinet members touched on it in their introduction. I mean, clearly any savings, any reductions in potential capacity to invest in these crucial services for our community. If we could avoid them as a council, I'm sure we'd all avoid them as a council. But there is a harsh fiscal reality to the challenges that public services face, and they fall to us as well. I think, as both Jane and the cabinet members commented, there has been relative protection, but it can't be total protection. The level of effectively the extent of the inflationary pressures on our services, particularly at the moment, are beyond anything we've ever seen. You know, we're talking 10, 15%. Some for some of our services, it's rising as high as 20%. And there just isn't enough money in the system to cover all of those costs without making reductions. And hence that gap and that £6 million challenge. What we've tried to do is, first of all, set our stall out around it has to be safe. Our offer has to be safe. So first and foremost, we've gone for safety and making sure that we that we appropriately structure our offer and resource our offer, to promote that safeguarding responsibility. So that's number one. There's also, and it features strong in Jane's presentation and the cabinet members' introductory comments, there's something around absolutely needing to be efficient. And I'm pleased that you acknowledged, Tony, that we have demonstrated that relentless drive towards efficiency, irrespective of the challenge that's faced us. And we've got a good track record. I'd say, it's not. I wouldn't necessarily go back 10 years and say we could demonstrate it, but I would go back 5 years and say that as a directorate, we have demonstrated that relentless drive towards efficiency, and that has helped us balance, definitely helped us balance the budget year on year. And you don't need to go back too many years when we would have had year on year overspends within the directorate. I think that's played a full part. That becomes tougher. Not that we would stop being efficient, but that you can actually realise a financial benefit. But there's still some areas, and James touched on them, where we think, well, there's still areas for improvement there. So safeguarding, efficiency, and then the third big process is over the last few years. Again, we've had a good track record of moving our offer to more of a focus on prevention, early intervention, and wellbeing. And of course, the temptation when things get tough is to say, well, stop doing that, because that's not necessarily your immediate statutory responsibility, despite that actually most of the policy and legislative guidance does indicate that that move towards a more prevention, early help offer is the expectation. But if you drill down to what do you absolutely have to deliver as a council, a lot of that prevention stuff, you could say, well, no, actually, it's not a core statutory responsibility. Therefore, you can do away with some of it. And we have taken a stance, absolutely supported by the cabinet member, and I hope continue to be supported by the council, that is self-defeating. That's not good for our population. That doesn't fit with us being the best that we can be. And also in the long run, it doesn't, in the end, lead to an overall saving on expenditure, because that demand will come through at some point, and at some point you will, as a council, have to respond to that. And what we all know is we'll find that we have to respond to it, and at that point it will be more expensive demand that we're responsible for providing. So we might get away with something in the very short term, but it's self-defeating. It's not good for our population. It's not good overall in terms of sustainability of health and care services in the long term. So as broad principles, that's what we've gone for. I suppose another one is overall, every bit of the directorate has had to, inevitably is impacted, so that we haven't said that there's nowhere in the directorate that we can say no, we'll leave that. That's almost a sacred cow type thing. We won't go near that. Everywhere is impacted. If we follow those principles, and if we deliver not just this coming year's savings, but those future fiscal asks that inevitably will arrive, that everywhere needs to have applied that rigour. So relentless focus on safeguarding, relentless focus on efficiency, and don't do foolish things where we start just wiping out prevention and early help offers in the hope that that's a quick and easy win. It never is. So that generally it from an officer perspective, but I've left some areas for the cabinet members to chip in with.
I think politically, speak for both of us, you know, echo exactly what Dave said in terms of the principles. To answer your question about the fees bit in particular, I think, you know, I too am uneasy about fee increases. I think we all are, especially at the current time. However, you know, just for reassurance, everybody is subject to a financial assessment to see what they are able to afford. There is that maximum, that cap or that maximum contribution, which is set by the Welsh Government. Hopefully some of the increasing costs will be covered by the uplift to universal credit, other benefits that people will be receiving. And we have, officers have written as far as possible to everybody who is in receipt or is paying for services at the moment, so that they've had the opportunity to ask those questions that they understand. And as the presentation showed, we hope it's only about 25% of people that are going to end up paying more. And in some cases, that's not going to be substantially more because of the cap. So it's not, obviously it's not what we want to do, but unfortunately I think what we have to do with inflation, what it is, and that little bit of extra income that it's going to bring in. And I think people recognise that, as well as the consultation has shown. Hayley, did you want to add to something?
I think Councillor Gibbons has covered everything I would have said around the cap, and Dave has obviously mentioned everything around early intervention and prevention, and continuing with that was key, I think, going forward, to prevent people from reaching crisis, and an escalation of you know, complex care needs then.
Okay, thank you. Chris, you've been very patient there.
Yeah, thanks. Thanks, Chair. I think there's quite a few things in this budget which I congratulate you on being it looks as if you've got a 53,000 overspent, which is very, to put it bluntly, exceptional. I think there's a couple of things. A lot of the comments that have been, or a lot of the things that are in the savings are, an example, complex care 25,000, external residential care, I think that's 500,000. I think it's 500,000 anyway. Let me have a look. I think there's a few things in there that need to have greater explanation, if I'm honest. The children saving 500,000, but I think it's already been said about the vacant posts. You know, the savings on vacant posts, always quite right throughout the council. This is not just in social services. It's quite a yearly comment. You know, you leave a post open for 3 months and you've got that savings, but do we use agencies to cover that? We all know that the cost of agency workers is considerably higher. And so I think when we look at agency posts, vacancies, that we need to ask the question, are we filling some of those vacancy posts with agencies? Or are we, you know, again, running short of people in some of our residential homes or domiciliary care or what? So I think it's those issues. I think on top of all that, you know, we have become more efficient, but we've been more efficient because we've changed our operation and raised the bar in certain fields where, you know, where we used to give a lot of care back. And admittedly, it's many years ago. We used to give quite a lot more assistance to people living at home, where that has changed, and we've changed a lot of our modus operandi in many different places. So we have become more efficient, but that efficiencies come at, you know, a cost of not doing certain things as well, or doing less of certain things. So I think is that the extra increase in the £1 million, it is quite a lot, and to think that only 25% are going to be paying that £1 million, you know, again, I think an explanation on that is required. So overall, I think the budget, I can see that £6 million savings is necessary. Not quite sure at some of the savings come on, you know, about the review for extra care. You know, what concerns me more than anything else is there's lots of figures in there, lots of descriptions which you know, in the narrative in some of those savings, it's quite bland. You know, and it's so my questions really would be the explanation about how we do, you know, we review extra care and save 150,000. How we do external residential care. What we're going to do? Are we renegotiating the fees, which you said, or are we pushing less people into these homes? And on the fees, I can understand if it's only 25% of the population going to increase 1 million. You need to ask yourself how much some people will have. I understand what the cabinet member said about the increase in universal credit, but we need to understand that central government is not exactly the most generous organisation in the world. So it does surprise, it does concern me. And I think the children's savings of 500,000 of it's a little bit more explanation about some of those subjects. Thanks, Chair.
Thank you, Chris. Who wants to answer that one?
Shall I go first
Start with Julie, then.
on the children's savings? So the 500,000 there is based around a few things. One is we're offering a great level of scrutiny and challenge to external providers, particularly where their percentages around the charge relating to the profit that they're looking to gain from a child's placement. So there's a high level of scrutiny around that. We are looking to put less children in external residential care by growing our in-house residential provision. So that you see would also reduce the cost to the local authority, and also growing our in-house foster care provision so that less children are needing to go into residential care. So we've got a plan over the next 3 to 5 years that will enable us to achieve that level of saving across child and family services in relation to what we currently pay out for external residential care for children.
I'll pick up the fees and charges. You're quite right, Councillor Holly. It's not as straightforward as saying the fact that we are increasing the fees by, or recommending the fees are increased by 10%, that in and of itself it will then realise £1 million savings. Over a number of years now, we've moved the council have moved their charging model effectively to better reflect a full cost recovery approach. So over a number of years, what used to be, actually there was no match between the actual charges that we levied and the cost of those services. This is a further implementation of that same model. I suppose the difference is that significant inflationary pressure that we haven't seen, in previous years, and that was why we specifically went out to consult on that proposal. Because whilst it's consistent with what the council has done over a number of years, it looks exceptional this year because of the level of uplift. So in and of itself, it doesn't become a significant change to a huge number of individuals. But if you looked over a number of years, that overall difference in approach that the council has taken and has now maintained, that is, a significant change. So some of our financial modelling isn't just on the implications of the change this year, it's what's the consequence of that 5-year approach for how it will now play out in the coming year. And actually the biggest expected further increase in income generated is the number of individuals who, when they start taking, having to pay for their care, predominantly when they move into more institutionalised settings, often don't at that point pay the charge because they don't want to sell their property, etc. But the point that those individuals die, a better way of saying it, at the point that those individuals die, there is a charge then against their estate. So it's the consequence of all those years. But our recommendation is has been to Cabinet, and that's what they've gone out to consult on, is they shouldn't make, they shouldn't break that link now. And I know the Cabinet member thought long and hard about that advice for the reasons that you've described and the reasons that she's iterated. But the problem for the council of making that break, having done the hard work in a number of years, is you store up a significant problem in future years. And my advice would be, at some point you would then have to make the connection again, and that would be more of a problem for your community, because then people would be subject to a higher jump at that point when you realise that you couldn't afford the care that you need to provide because it's become too costly. But you're quite right to flag it, Councillor Holly. It's not a straightforward link between just this uplift this year generates the £1 million. It's the uplift this year and that link with maintain a model of full cost recovery, albeit everybody's subject to a final financial assessment that in the end we anticipate will generate that £1 million extra over the coming year. And then, further again in future years is the reality. I don't know if we missed any of your questions though, Councillor Holly.
No, you haven't really. I think the vacancy post one you haven't come back on, which always is the same for all the directorates anyway. So, I understand where you're coming from on that. I think about the increase in the fees, because you put £1 million in this year, I suspect that £1 million will be a arbitrary figure anyway. Because as you rightly said, and it's a cynical way of looking at it, but it has to be looked at that if people depart and they've lived in an accommodation and they need to recover those fees from the estate, you don't know how many people are going to pass away in that year. So the fee increase in that year is a very artful figure. So I can understand what you're saying about the million, but I would like you to comment about agencies, please, agency staff.
Yeah, thanks, Councillor. Sorry, I missed that bit. I'll come back on the fees bit. Right, you're right. There is absolutely a level of science behind us working out, but the likelihood of getting it absolutely right to the pound, right, but it's based on 3 or 4 years now of working in this way. So we're reasonably confident we'll be there or thereabout. But if we get it wrong, there'll either be an underspend or an overspend. Is the truth of it, and we're pretty good nowadays at getting that reasonably close. On the you're right. The risk of we spent many years removing a vacancy saving from our budgets because for obvious reasons really, where we're under. If I picked an area that we'd be really worried about, Julie's area, frontline, child protection, social workers, don't really want to have any period of time where there's a gap between somebody leaving and then being able to appoint new. And in those circumstances, if push came to shove and Julie didn't have enough social workers, then we would give her permission to go and get an agency worker if she needed agency cover. And the vacancy saving does give that extra level of, I suppose, flexibility for the heads of service to prioritise when they've got urgent demand that needs to be met, that they've got money in the budget to be able to do that. So that was a logic of removing vacancy savings. But nevertheless, we are in a position now where we've got a significant challenge overall. And I suppose it was a choice between do we reduce the numbers of staff that we model across the directorate, or do we accept the reality that Jane described of, look, there is a lag. There just is a reality of a lag, and you can attach a financial figure to that. But if we go back to our principles, there is still going to be the same expectation. If the head of Child and Family Services comes to me and the cabinet member and says, I don't have enough social workers, I'm achieving my vacancy provision saving, but actually, we run the risk of the service not being safe. Then the decision's going to be, we'll get an agency social worker in then. So it could play out absolutely in the way that you're describing, Councillor Holly. We've tried to model it to account for that. So we haven't gone below staff establishment figures, that if sickness absence rates are at a reasonable level, we take into account of things that are that we know in advance, how much leave, etc. And then we've made a judgment about, well, what's the level that we think theoretically we could cope with if it works well enough, but if it doesn't, then we're going to clearly make a choice about, no, we're going to have to spend some more money there. There'll then be an onus on us to make sure we make in-year savings elsewhere, and we'll have to return to that. And I'm sure that'll pose questions for the scrutiny committees as we go forward. So it's a bit of a judgment of, it's a harsh reality. We didn't want to make staffing cuts to the establishment for all the reasons that we've described. We think we can accommodate this level of vacancy provision across what is an enormous service still. We shouldn't forget that, and Jane described, we've got £90 million worth of spend on staffing across the full range of staffing levels. There will be some recourse to agency, there always is. I don't anticipate that recourse to agency in the coming year will be as great as it has been during COVID and in this past year and post-COVID. The areas where I do expect some recourse to agency staff is, I do think, Julie, we will be relying on some agency social workers. I think there'll be a significant reduction in any use of agency social workers in adult services in Helen's and Amy's area. And I expect what has been a high recourse to agency provision in things like residential care homes for older people, that will start to reduce. And it has started to reduce. I know the figures that were before audit committee were out of date. If up-to-date figures had been there, what you would have seen was a further increase as we ran up towards Christmas, and then quite a rapid drop-off. And I expect that drop-off to continue in the coming year, because the reality is the impact of COVID, other respiratory illnesses, etc., is starting to reduce. And I think it will be down on the coming year. So I don't expect it to be the same kind of challenge. And in the end, you're right, we've had to make a pitch on what do we think the financial implications of all of that are. And then we've come up with the recommendations for Cabinet to consider. And I think it's reasonable. Prefer not to do it if we could avoid it, but you have to face the harsh reality of public services are under considerable fiscal pressure, and we have to respond to that.
Okay, thank you very much for all your answers, Dave.
Okay, thank you, David. Sue, you've had your hand up for a while. Would you like to come in with a question?
Well, it's comments as well as questions, yeah. I'm glad to see that the first priority is safety for individuals, and the efficiency is a priority again. And my want is that the focus is on the LACs that are doing preventative work in the communities, and I'm glad to see there's no reduction in staff in that, because I think they've been a real bonus for people to prevent them having to go into services, maybe pushing it forward for a later date type of thing. Yes. I was interested in the new or upgrading of a system to see if that would reflect some of the savings in the future. Concerns about client charges, I think it's been highlighted anyway. In the light of the poverty that people are having at the minute, I think that's a great concern. Co-production, very important at the minute, and working with health and social services together is even more important. Agency staffs are going to be a concern, because I think we need to have people that are committed to our services. And again, great that no staff reductions, but maybe risk assessments of the services that we provide in future would be something that we would be looking at. So really, I don't know if there is a question there, it's just comments really. Thank you.
Thanks, Sue. Who's going to pick that one up?
I'll just say, yeah, I endorse what you've said, Sue. I think I think you've hit the nail on the head there and support your comments. And I'm sure Hayley will say that the work of the LACs is really vital. It's in your portfolio.
Yes, yeah, thank you, Sue. Yeah, we are committed to continuing with LACs, and as you know, we've got a full complement across the city, and they work in in our communities, which is key. We co-production, that's again sits with me, and there's lots of work going on at the moment with co-production, and there's co-production champions across all directorates, not just social services, but there is a strong drive moving forward with that as well. And just to bring in another point around re-ablement, or continuing to promote the lives of individuals so that they remain independent as long as possible. I think that was on Councillor Hawley's point actually, but just to bring that in as well.
Okay, thank you. I don't see any other hands up. Anyone? Tony, you want to come back?
Yes, please, Chair, if I may. I'm intrigued by this notion of co-production. Because in my former world, it was patients and professionals working together for all the patient's individual need. But as we've been talking, the thought that's gone through my mind is whether there is or whether there should be a form of what you might call organisational co-production that brings together social services, the National Health Service, possibly education, and possibly housing. To look at the different strands of where investment is being made, and whether, in the light of the current challenges and the future challenges, that partnership might develop its own search for efficiencies and sharing and whatever. I mean, I sense we may be close to that, but I'd like to think we were. But is that still a distant nirvana?
Yeah, absolutely. I mean, it's not perfect how we operate at the moment, still work to do, but that ethos that you're describing, organisational co-production, and the agencies that you referenced there, that very much features in the model of transformation that the Regional Partnership Board is driving forward. For example, we're trying to do it within our own organisation as well, and how we work locally. But again, that's framed in the context of regional priorities that we've agreed, but it does go further than that. It's the so you're right. Traditionally, we might have been focused on co-production with an individual around the delivery of their own health and care support, and then we might have had some partnership working as organisation. But our true co-production approach and our true ambition is you bring all of that together. So citizens, via various groups, etc., are actually involved in that discussion with education, housing, social services, health, around the future redesign of overall service delivery as well. It's challenging when it's exciting. When it works well, it's really good. And when it's not working so well, it's quite painful. But we are committed to that approach as we're going forward. And I know that both the cabinet members are fierce champions of that.
Yeah, just to add to that, I think I agree with what Dave's saying. I think we've got some good examples of that. Perhaps the corporate parenting board, for example, where we've got good representation from housing, from education around the table. If Alison was here, I'm sure she'd allude to things like the Poverty Forum, where with our third sector colleagues, how we're working together for the Poverty Truth Commission and things like that. So definitely, it's something that we need to do more of, and to break down some of that silo working. But it's definitely, we're on the right trajectory, and it's the right thing to do.
And just to build on that as well, it is around a behaviour shift and changing the way that we work as individuals or as partners, because it's changing from doing for to doing with, and that's really key in that. So yeah, we are committed to pushing that forward and improving outcomes for people.
Okay. from my point of view, I must admit, virtually all the points that I had down here have been covered fully already, so I'm not going to repeat those, that's for sure, which I'm sure you'll be pleased about. Just one slightly different question. We went through a commissioning phase 4 or 5 years ago now. I understand you're about to go back into recommissioning again. What impact have you built in terms of what you expect to come out of that? Have you built into this budget now?
And you saved the best one for last. So it's really looking at the demand coming through and actually understanding if the demand for services, is there an increase in demand, and actually then how are we going to make sure that there's enough money in the pot really to commission services to meet that demand, but also enough money in the pot to make sure you commission services in the best possible way so they can cover in terms of their costs as well. So it's an ongoing piece of work, I've got to say. There is an element of that built into the budget in terms of our fees when we look at that going forward. But it is really one that we're going to have to watch really carefully, because we don't quite, so inflation's really high at the minute, and then it's sort of peaking, and then is it going to drop, is it not going to drop, and actually what is it, just a one-off, or is it an ongoing cost that people will need to cover as we go through? So in terms of all of our recommissioning or commissioning activity, I think that's got to be one of the sort of the themes that go through about actually are we going out to market with a reasonable price for them to be able to respond and actually, you know, to provide a service in the best possible way. It's a really tricky one. So there's an element of it built in. I'm not quite sure if it goes far enough. I guess we don't know it as such as yet. But in terms of making sure that we are, you know, paying those prices that we go forward. Does that cover it? I think, Dave, in terms of.
Paxton, let us know if it covers it. Does that cover it well enough, Paxton?
It must be a concern. Certainly after the last commissioning process, you were intending carrying out reviews of how successful that process was and what the response of clients, for want of a better word, was. Because of COVID, I don't think you've had that opportunity to do that. And that is something you need to be looking at very quickly to see if there's anything you can do in that respect, to find out how people felt about the results of the last commission review. And all else I can do is wish you well with this next commissioning review. Okay. And I can't see any more hands up. I assume that's the end of questions that we have for you. At this point in time, I will ask officers to leave if they would, please, and the members of the committee to stay so we can discuss what we've heard now and make our responses or prepare our responses ready for delivery to the service improvement scrutiny performance panel tomorrow. Thank you very much, and many thanks for your input as well today. Thank you. Okay, then just to reiterate, obviously the function, our purpose today is basically to look at the budget from a social services point of view, make our comments on that and feed them back into the service improvement and finance scrutiny performance panel tomorrow. And the convener of that, Chris Holly, will take that then to the cabinet, reviews across the piece to the cabinet on Thursday. To be fair, I think Liz has been writing quite copiously in terms of what has been said over the last hour and a half, hour or so. In that sense, she will have picked up all the concerns that we have. I don't know if there's anything you want to add at this point in time, but what will happen, I'm sure, is that later on today, something will come out to you in terms of what our response should be. And you can have a chance to have a look at it then and take it from there effectively. If you've got any concerns, feed them back into Liz, and then we can accommodate them in there then before we actually present the paper tomorrow. Is that fair, Liz?
Yes, Chair, it'll be in the form of a number of bullet points.
Yeah.
So, and yeah, so I'll draft that as quickly as I can and get that round to everyone today, because it needs to go into the feed into the SIF panel tomorrow morning. So I'll do that this afternoon. And get that out.
So it's quite a rapid process. Keep an eye on your emails to see who coming through, and so you can make your comments. Is there anything you specifically want to make a point about at this point in time? There's a bit tautology there, I think, somewhere.
Can I just at this time thank you for chairing this meeting, Paxton, and being there on behalf of Adult Services as well.
Well, I owe you an apology for not being at the last Adult Social Services meeting, Sue, so it's no problem. Thank you.
Okie
Tony.
dokie.
Sorry? Tony?
Yeah, it's just a reflection really on one bit of the debate that you may or may not want to put in a particular way or develop, and that's this link between the social services department itself, the NHS to an extent, but housing. And it seems to me that the local authorities' ability to develop and refine and renew its approach to housing for people with particular needs is something that is worthy of looking at in terms of this co-production definition that we heard earlier. I mean, I'll give you an example. When years ago, the county council and the health authority and the housing association came together to provide what was called the integrated care and accommodation scheme in Gosainen, and it was a purposely designed building with a lot of assistance kit in it, and it was designed to take people who were ill or poorly or disabled in particular ways, to give them decent housing, and that they would never have to move from that location because everything would come both physically and in terms of the care packages that the NHS and the primary care services and social workers were building in. And I know the times have changed, but the challenges are more difficult. But you know, if I were to say, perhaps we could have some local authority housing that specialised in dealing with residents who either had at the time of coming in a form of dementia or acquired a form of dementia whilst being tenants of the local authority, as an example of keeping people in their homes and bringing the services to them rather than putting them somewhere else that probably they don't want to go.
How do you want to feed this into?
Well, I think it's this co-production notion in terms of saying, you know, we've got this ability to work together.
What would you say in terms of the budget that we ought to be doing then in that sense?
Well, looking to see whether on a partnership basis, the things that we're currently doing at a higher cost, the contracted in stuff, it could be done by the public services at a lower cost and a better quality.
Okay, but what I think we're looking at here now is not what's going forward, but specifically this budget, what we need to see and change, what changes we would need to see. That into effect. Yeah,
I can see the benefit of what Tony is saying, because recently we had a request from old age pensioners as we got younger people with learning disabilities who had a problem with it getting into accommodation. But I think maybe that perhaps will be a future thing for adult services too.
Yes, I wasn't proposing to challenge the budgetary statement, but just about a rider to say that having spotted the potential of co-production, that this is an area that we hope
will be
in future times to be developed. Yeah.
All right.
Yeah, highlight it. Yeah.
Okay, Liz will pick that up. Any other points anybody wants to make? In that case, I will say I'm going to close the meeting and say thank you very much for your attendance and the questions are asked. I think it'll give them some food for thought as well anyway, so that's what we're here for. Thank you very much.
Take care.
Thanks, everyone.
Bye.
Bye bye.
Bye.